and the second one was vitamin D. Okay, that's how big it is. So we also looked at her hormones, and they were all over the place. We did the dark field microscopy and saw that she had a high bacterial load, lots of oxidative stress and heavy metals. So NRT stands for Nutrition Response Testing. It's a type of applied kinesiology, muscle testing that we do in the office, where we look at different stressors and how it reacts in the body. So her priority was the liver. The liver kept coming up, like that was the first place that needed to be treated. So did a stool analysis and then saw that she had no growth of some of the good bacteria. So how did I treat her? So not in any particular order, but just a generalized idea of some of the things that we do. We did a lot of IV medicine because her gut needed to be healed. And again, sometimes we have to bypass the gut in order to heal it, because the gut is so out of whack that giving someone something orally, it's not bioavailable, they're not absorbing it. So how else can we help to heal them when it's gotten that bad? So we did a lot of IV chelation with glutathione. And are you all familiar with a little bit of what that is? So chelation is getting rid of heavy metals, as well as getting rid of plaque and decreasing inflammation in the arterial and blood system. Glutathione is a master antioxidant that we have and we produce naturally in our bodies. We did a lot of UV light and ozone with her. So this is something I'm going to take a minute to speak about, because it's had such an impact in my practice and on the health of the people that come to see me. So UV blood irradiation, it has to do with using light to heal. I mean, it's as simple as that, light to heal. And what we do is we take blood out of the body, we put it into some saline, and then we allow it to flow through 3 different frequencies of light. And with that, we experience a lot of healing, a lot of pathogens basically die off, a decrease in inflammation. So she received a lot of those, biomagnetism, acupuncture, some manual treatments. So ultimately, with this protocol, and I would say now we're probably at about almost 6 months. So around the 4-month period is when we really started to see huge shifts. So now she's driving, she brings herself to the clinic, she babysits her grandson. Most days her energy is about a 7 out of 10. Her labs have improved dramatically. And she comes into my office smiling and coping really well. And a lot of that had to do with her kind of getting inside herself. So for the most part, I probably see her about once a month right now, and the treatment that really seems to work for her is the UV light with the ozone. So something that I do recommend, and you probably do already, but if you don't, to really highly consider doing with your clients is cleanses, okay? So, and I like to do it in this order. Usually the colon, and they're seeing you, right? They might be doing some colonics. You want to really make sure that they do parasite cleanses at some point, address the candida in the body, then do a kidney flush, a liver flush, and then we can get to the heavy metals. And heavy metals don't always have to be taken out via IVs. It can be done orally. I do it a lot with my children. It just takes much longer. But do you want me to go back? I'm sorry. Okay? Case study number 2. So this is a 4-year-old male, one of my little ones, who comes in with ADD. So he was a full-term birth, normal, developing, all the milestones were good, his neurological development was fine. So he went and he received his second MMR vaccine, okay, mumps, measles, rubella. That night, went home, parents noticed, speech became impaired, and he started getting hyper over the next day or 2. All of a sudden couldn't perform things that he had been doing just a week before, like feeding himself. He's a 2-year-old. He could have fed himself, putting on his shoes with the little Velcro. Couldn't do any of that. By the time I met him, he was almost nonverbal, just making sounds, jumping off of my desk, jumping off of my table, which is okay as long as he's safe, but that's the degree that it had gotten to over the past few months. So because he was little, we didn't want to do a lot of blood work. We did the dark field, the live blood, okay? It showed heavy metals, parasites, and some red blood cell stacking or congestion. When I evaluated his body, the priority kept coming up as the large intestine. So we started him on an anti-parasitic program with rectal ozone and enemas alternating, okay, 1 day on, 1 day off. I used that restore that I showed you, right, those redox signaling molecules, and he did biomagnetism once a week for 4 weeks. So what biomagnetism does is it changes the pH in the body. It helps to kill pathogens and also create an environment that cancer cannot grow in. It has to do with shifting the polarities of our cells. We made some changes and started some desensitization treatments. Okay, so after about 4 to 6 weeks, he already seems more calm. His verbal communication is starting to return, so he's actually saying some words again. Apple, fly, just different things. Multiple parasites were being expelled with his enemas. Okay, and I'm going to show you a picture in a moment. So we're going to just kind of continue this protocol because we want to be gentle with his body. So once we've kind of shifted over this stage, the next thing is going to be looking at how we want to get some of these metals that we saw, which probably are from the vaccines that he's been receiving, okay, getting them out of his body. So I want to show you a picture. This is one of many parasites that came out of him. We put it on a plate so that we can kind of show you the size. And I mean, this is coming out of him constantly. So whatever stressor, whether it was the vaccine or something else that basically breached the integrity of his gut, is allowing all of this to exist. Okay? 4-year-old. Case study number 3. This is the last case study. So this is a 54-year-old overweight male who comes to see me. He has high blood pressure, diabetes. He's on testosterone, wants to lose weight, hasn't been able to lose weight. I run his labs. He is hypothyroid. He has high triglycerides and multiple cardiovascular risk factors. And on top of that, his testosterone was way too high, which isn't a good thing when you have cardiovascular risk factors. Again, low vitamin D. He had a methylation genetic defect, low amino acids, high arsenic and mercury, okay? And his hemoglobin A1C, which is related to the diabetes, was out of control. His priority organ showed up as the adrenal glands, probably because handling all of this was a whole lot. And he was also on multiple medications. Pharmaceuticals, you know, I come from that world. There is a place for them, right? There is a place for them. However, they have been given too wide of a playing ground, and we need to take that back. So I started him on Nature-Throid, did some things to cardio protect him, okay, help his gut, definitely decreased his testosterone, and really got into the IV programs. I put him on a weight loss regimen, started colonics, and he started yoga and meditation. So currently, he lost about 60 pounds over the last 6 months. His numbers look so much better. He still comes in for his IV chelation and colonics once weekly. So if you notice, my programs really involve a lot of gut health, organ system balance, and the IV medicine, okay? It's huge. So if I were to summarize, in terms of healing yourself and your clients, creating an alkaline environment, whether you do it through nutrition or something else, you know, the greens, right? Tonifying that immune system through the belly, detoxifying, right? We talked about the colon, the parasites, the kidneys, the liver, the metals, killing pathogens that we don't want there. A lot of them we do. And then making sure that we balance the autonomic nervous system, hormones, and neurotransmitters. And again, we saw how these are all kind of interrelated. So, I tell my patients this all the time when they come in and they're saying, am I going to die tomorrow? Can you help me? Well, I can help you as much as you want to help yourself, right? This isn't, I'm going to hold your hand and do it for you. And a lot of things are out of my control. I can have 5 patients and I can do the same exact gold standard alternative regimen, and they all do very differently because we have to look at the other places, right? What are their stressors? What are their stuck places? Where's their emotional body? So the best thing I can say is become informed, There's so much miscommunication of information in our media and all around us. You know, really look at where you're gathering your information. Okay, be your own best advocate. I can't tell you how many times they come in and tell me, I'm scheduled for surgery next week because the cardiovascular surgeon said I need to do this, or the orthopedist said I need to do that, and I'll say, well, what do you feel? What do you think you need to do? Does that sound good? Does it feel good? Because if it doesn't feel good, even if they do the best surgery ever, you're probably not going to be well. So what else can we do? Obviously, if they're in the middle of an acute MI, I'm not going to ask them that question. I'm talking about situations where we have some room. If we have some room, let's try something different. Consider all aspects of your being, right? The mental, the physical, emotional, and spiritual. And I showed you why and how. Pay attention to your thoughts and actions. Be patient with yourself, mostly. And then be patient with those around you. And when in doubt, like when someone comes in and I have no clue and I've fixed the belly and I've gotten rid of the metals and they went and they took out all their teeth and whatever else had to happen, and we're still stuck, and I'll sit there and I'll say, okay, what else can I do? When I get into that place, I just get quiet, okay, and listen, like, what else is there? Or it might be that my journey with them is over and they need something else, or they don't really necessarily want to go to the end of that journey, right? And we have to accept that too. That's not my call. So, I absolutely love this picture. Just as a side note, just to mention, you know, elephants never get arthritis. As huge as they are, never. They don't get arthritis. So, this is our wellness center. We're right here in Tarpon Springs. It's about a half hour from here. You know, I'm going to hang around. I'll be here tonight. I mean, we have some time for a few questions, and you know, now. But if you do want to come in or you want to ask a question, I'm more than willing to offer any information that I have to help you or someone that you know. And we certainly, you know, can do something to help you get to us. The time? We're at 52? Okay. Sure. So Mark is going to walk around with the microphone so we can hear your questions better, if anyone does have a question.
I might ask you to come up if you have a question so we can get you
or
on
if you
tape.
need any elaborations. Wow, it was that good. You all understand everything. This is great.
We got one question over here.
Thank you. That was great. Do you work with people long distance?
Sure, absolutely. Absolutely.
Hi, I think I have at least half a dozen of root canals. How do I take them out? How do I take them out without losing the teeth?
Sure. So she was saying, for those of you who did not hear her, that she has about a half a dozen root canals, and you know, how does she manage that without losing all of those teeth? So what I would probably do with someone like you is evaluate, you know, whether it's through kinesiology or some type of a biofeedback modality, just what the impact is, and I would probably prioritize if there were those one or two that were infected and really needed to be addressed, and start there. It's really hard to save those teeth if they're badly infected, you know, so it's a little tricky. It is a little tricky if you have that many, but there are ways to do it to still manage your health, you know. We'll just have to prioritize and see what is the absolute necessary to create a balance, okay?
Do you use a zeolite at all? For the
I do. I love zeolite. Absolutely. And it's great for my little ones because it's so easy for them to take.
The picture of what you referred to as a parasite coming out of the 4-year-old
Yes.
on the plate, was that laboratory tested? Do you know that it's a parasite, not mucus?
We did have it tested, and yes. And he had multiple different ones. Yep. They were tested.
Thank you.
Yes.
With the root canals, if people get posts put in after, is that something that you've seen the same issues arise, or is it just with the root canal?
So if you can go to someone, like a dentist, you know, that you trust, who understands what we're talking about, and they can test you see if that post really agrees with you, kind of go through a series of how well your body's going to interact with that material. I've seen where it can really work out. If you go to someone, then they kind of don't know and they just put anything in there, you might kind of go down the road of having some more reactions. Yeah.
What about things like titanium rods or people that have rods,
Yeah.
in their jaw and their back, things like that?
Again, and there's no one cut thing. It's how that responds to your body. So titanium might actually work really well in someone. That's why I'll never tell a patient of mine that something that we all know to maybe have a stigma may necessarily be bad for you. I don't know that. I have to ask your body. I need to see where that is with you. It's very individualized.
Is there a place where you can take that person who has rods that they can't remove
Where are you located?
in Utah?
Ooh. I
Yeah.
just came from Utah last week. I was in Snowbird.
Oh, serious?
Yeah, for a conference on ozone and UV light and
Nice.
prolotherapy and prolozone and all kinds of fun stuff.
Awesome.
You know what? Let me get your info and see if I can help you find someone, because I do know a lot of practitioners there.
Thanks.
Sure. Okay.
think our
So,
time's-
one
I'm
more, I
sorry.
think. Is that it?
One more question?
Nope, she's
We-
saying,
we don't
she's
have
saying
time.
that's it.
Okay.
Okay, well, thank
Thank
you
you.
all so much. I appreciate your time and your attention.
On behalf of IAC, we'd like to present you with a plaque
Oh.
of our appreciation.
Taking this off, and now he's doing something.
We'll help.
Oh, thank you.